53. 15-year-old boy with periarticular osteopenia, loss of joint pace at the metacarpal joint and widened paces in the proximal phalanges, a spiritual reaction in the metacarpal bone, most likely diagnosis juvenile rheumatoid arthritis. The 15-year-old boy with all these rheumatoid signs and symptoms, diagnosis juvenile rheumatoid arthritis. 54. Increased uptake on bone scintigraphy represented with normal X-ray metastatic disease. Increased uptake on bone scintigraphy and with normal X-ray diagnosis metastatic disease. 55. Radiological evidence of frontal signs first appears at 6 years. Make F upside down and close its caps with 6 radiological evidence of frontal signs appears at 6 years. Radiological evidence of frontal signs appears at 6 years. F for 5 to 6. So radiological evidence of frontal signs appears first at 6 years. 56. Squaring of the vertebrae and floating osteophyte seen in psoriatic arthritis. Squaring of the vertebrae and floating osteophyte are seen in psoriatic arthritis. 57. 17-year-old wedging of multiple vertebrae at the thoracolumbar junction, multiple limbus vertebrae, increasing AB diameter with a reduction in cycle height of multiple vertebrae and multiple end plate defects. Diagnosed Scheuermann disease. 17-year-old with wedging of multiple vertebrae at the thoracolumbar region, multiple limbus vertebrae, and increase in the AB diameter with a reduction in the cycle height of multiple vertebrae and multiple end plate defects. Diagnosed Scheuermann disease. 58. The following contain a finding in a 10-year-old girl. Which of the following diagnoses? Ethnic is an ulna, worming bone with skull vault. It is hyperplasia of distal third of clavicle and associated with of the distal triangles. Diagnosed urinary dysplasia. Following contain of symptoms. Epson is an ulna, worming bone within the skull vault. Hyperplasia of the distal third of the clavicle. Diagnosis cleidocranial cystosis. 59. Cleidocranial dysplasia. Delayed closure of the frontalis with widened sutures. Cleidocranial dysplasia. Delayed closure of the frontalis with widening of sutures. 60. X-ray of elbow hand posterior flat part all pathological. X-ray of hand elbow / hand posterior flat part all pathological. 61. 18-month-old boy with swelling of the wrist and ankle marked metaphysal cupping of distal radius and ulnar and agreed thinking of the radial cortex most likely diagnosed rickets. 18-month-old boy with swelling of the wrist and ankle marked metaphysal cupping of the distal radius and ulnar and agreed thinking of the radial plate most likely diagnosed rickets. 62. Rickets, basilar invagination. Rickets shows basilar invagination. Rickets shows basilar invagination. 63. 64. Hallmark of mastomalacia bilateral loosened zones. 64. Hallmark of mastomalacia bilateral loosened zones. 65. Characteristic of mastomalacia bilateral looser zone. Characteristic of mastomalacia bilateral looser zone. 66. To see ACL, best way is extension. Flexion is like anterior drawl sign of tibia on 5 minutes ACL disappears. The best way to see ACL is extension. Best way to see ACL is extension. 64. Which adhesion feature would support diagnosis of ACL rupture? Tear of the medial meniscus. Punching of PCL, medial and lateral meniscus tear. Peroneal feature would be supportive diagnosis of ACL rupture, tearing of the medial meniscus. 68. Ski injury, anterior knee instability, positive anterior drawer sign, and McGregor test. Small bony fragment just lateral to lateral tibial plateau, most likely company finding medial meniscus, anterior cochlear ligament tear, and chicken fracture. Ski injury, anterior knee instability, positive anterior drawer sign, and McGregor test. Small bony fragment just lateral to lateral tibial plateau, most likely company finding medial meniscus, anterior cochlear ligament tear, and chicken fracture. 69. Regarding X-ray knee joint, wrong option is centering 2 inch above patella. X knee joint, wrong option is centering 2 inch above patella. 70. Features suggestive osteoporosis, posterior convex vertebral bodies. In osteoporosis, we see posterior convex vertebral bodies. 71. Calcification seen on skull X-ray causes hyperneural calcification. Calcification seen on skull X-ray causes hyperneural calcification. 72. 72. Girl with knee joint pain, fever, and general lymphadenopathy. Diagnosis tuberculous arthritis. Girl with knee joint pain, fever, and general lymphadenopathy. Diagnosis tubercular arthritis. 73. Solitary well circumcised rounded light gland with cortical expansion at the type of the middle phalanx, most likely diagnosis and chondroma. Solitary well circumcised rounded light gland with cortical expansion at the type of the middle phalanx, most likely diagnosis and chondroma. 74. Small central lesion within the medullary cavity of the middle phalanx of the index finger. Follows the expansion of the bone, the thinning of the cortea, most likely to represent and chondroma. Small central lesion within the middle cavity of the middle phalanx of the index bone to diagnosis and chondroma. 75. Anterior paraspinal soft mouth at L1 to L3 extends to the left psoas muscle and most likely infects organism mycoperium tuberculosis. Anterior paraspinal top mouth at level L1 to L3 extends into the left psoas muscle, most infectious organism Mycobacterium tuberculosis. Here's best answer regarding cystitis. Decrease marrow intensity on two consecutive vertebrae on T1 MR characteristic. T for cystitis to decrease marrow intensity on two consecutive vertebrae. The best answer regarding cystitis. Decrease marrow intensity on two consecutive vertebrae on T1 MR characteristic. T for cystitis. T for decrease marrow intensity on two consecutive vertebrae. Amyloid of fluid apparent degenerate synovial line bursts resulting in pain and causes ruptured Baker's cyst. Amyloid of fluid filled degenerate synovial line bursts resulting in pain and causes ruptured Baker's cyst. 78. 8-year-old woman with bone metastasis most likely occurred primary lesion carcinoma of the breast. 8-year-old woman with bone metastasis most likely occurred primary lesion carcinoma of the breast. Is a 80-year-old woman with fall radiograph revealed hip fracture, which fracture site most severe pathological fracture, subtrochanteric fracture of the left proximal femur. 80-year-old woman fall radiograph revealed hip fracture, which fracture site most severe of pathological fracture, subtrochanteric fracture of the left proximal femur. 80. Why have multiple heart swelling around the knee, multiple bony growth extending laterally from the bone and pointing away from the nearest point? Correct and continue to the native bone, most likely diagnosed osteochondroma. Multiple heart swelling around the knees, multiple bony growths extending laterally from the bone and pointing away from the nearest point, cortex and continue to the native bone, most likely diagnosed osteochondroma. 81. Functional endoscopic sinus surgery planning. Right frontal sinus base shows dense lesion which appeared to contain compact cortical bone and protrude into the sinus cavity, most likely diagnosed ivory osteoma. Functional FESS planning. Right frontal sinus base dense lesion which appeared to contain compact cortical bone and protrude into the sinus cavity, most likely diagnosed ivory osteoma. 82. Prominent vertical striation L4 vertebral body, well-defined lesion returning high chin on T1 and T2, then L4 vertebral body is hemangioma. The well-defined prominent vertical striation L4 vertebral body diagnosed hemangioma. 83. Slightly expanded mid-thoracic vertebral body with coarse vertical trapezoidal polka dot appearance, most likely diagnosis hemangioma. Polka dot appearance seen is hemangioma. 84. Radiation injury to bone caused by obliterative enteritis. Radiation injury to the bone caused by obliterative enteritis. 85. Achondroplasia recognized radial feature is flat acetabular roof. Achondroplasia recognized radial feature is a flat acetabular roof. 86. Infected cystitis most likely causative organism is Staphylococcus aureus. Infected cystitis most likely causative organism is Staphylococcus aureus.